Yeah, and I've seen you have injectables, there's cream. Is there pill format too? Yes.
So there is pills, and that's kind of like, being looked at. It was one of our first lines, but guess what? Whenever you go into your stomach,
Yeah.
has to go through what's called the first pass metabolism. And so your liver takes most of it out.
Okay.
So we had to give really high doses to get it through the liver. So it would cause hepatotoxicity. Some people, had big acne and a whole bunch of other stuff. So the orals were never,
Never like
most popular. And then
what is the
came up
cream one?
the test. And I think what's cool about the creams is it's, yeah, like it's provincially covered for our patients. So it's not going to be a whopping price. It follows the natural curve. So if you're doing it once in the morning after a
Oh, it's
shower,
just a cream you put it.
it's a gel.
It's a gel, yeah.
And within a really rapid amount of time, it's absorbed. So it's the vector is this sort of alcohol that, it was once Axeron under the armpit, like a deodorant.
Yeah.
Now there's androgel, there's Testim, like a foam. There's even one transnasal. So
Wow.
the whole concept transference where you put it on and then you're gonna go hug your son and your daughter while hey mom, I'm growing a mustache. So
Uh,
so
uh,
so
I'd use my son. Come here, boy. Give you a hug.
big hug. That's always hugging me. So the whole idea that there's that other option where is there an option that's going to be no transference, to the other partners of the family, and it's in the nose, and that's the testo. So it's the sort of the new kid on the block,
Wow.
and they're
So
great.
you're taking like your
Yeah,
TRTs
just
and
it's this like
just
almost like
spread, yeah.
a type of oil, and kind of like hydrates your nose, and you put on one on each side, and you do it twice a day, and it follows that natural up and down pattern. And it's one of the few TRTs, testosterone replacement therapies, that has some evidence that it protects spermatogenesis. So some men here, look, I want to have children, but if I'm going to do those other forms, I may get some testicular atrophy and may impact spermatogenesis or making of sperm for fertility. So, there is those options. There's in the States other ones who do implants or, but they're not as popular or as available in Canada.
And then you have the injection, which is probably the most common one.
I,
Is it?
again, everyone has different views, and I know other family members and so forth who are doing the injectables, but they just don't want to have, do it every morning, and they'll do the injections, but there'll be more cyclical changes day to day, week to week, because they'll do a big bolus, and rather than having a smooth pattern, you'll go super physiological and then decline. So if you look at the data, in terms of what are the biggest side effects, some people just, I don't want a needle. I have to inject
Yeah,
myself.
I
It'd
wouldn't
be
be
a
able
pain
to.
at home.
I wouldn't be able
Kind of like
to.
you look, it's suspicious and so forth. But everyone has a different view, and some people it works great. Some men who are big hairy guys and sweat a lot, that may be the right option because it doesn't get into the skin. So everyone has different views. Some people enjoy the boost and being that super physiological, but there may be a chance that you'll have some of the side effects of TRT, which is increased hematocrit, so thicker blood, kind of like some of those cyclists, they dope and you get thick blood, you can get clots. So that's why we check hematocrit to check the thickness of the blood. We'll check the liver function enzyme. So some of these could be toxic at high levels. Um, and then you have to check the PSA for men in certain ages for prostate cancer. It doesn't create prostate cancer, but if you have prostate cancer, you may be feeding the fire. And those other elements of checkup is important. So by doing those different options, at least knowing what they are and making sure that you want to deliver them and that you're going to be consistent,
Mm.
that it's going to be easy in your regular lifestyle. And are you hugging your family all the time? If you have young kids, or are you looking to have children? Those are going to be some of the questions you're going to want to personalize in your treatment.